Hello everybody here and welcome you all to our today topic about the saliva in relation to COVID-19. So please at the beginning let me introduce myself to you all. Manal Eltahir, BDS Khartoum University, MD, Sudanese Medical Specialization Board, Oral Maxillofacial Surgery, Fellowship Fellow of the International Association of Oral Maxillofacial Surgeon, um, membership of the Royal College Faculty of Dentistry, Royal College of Surgeons, Ireland, and fellowship of International Board for Certifying Surgeon of Oral Maxillofacial Surgery, Chicago. Now I'm assistant professor at Qassim University, KSA College of Dentistry, Department of Oral Maxillofacial Surgery and Diagnostic Science. Before time, I was assistant professor of Oral Maxillofacial Surgery, International University of Africa, Khartoum. So, for our talk today, this is abstract for our talk for today about the COVID-19. About COVID-19. So, uh, as it is designated by the WHO, as COVID-19, this is infection outbreak is constitute a real disaster worldwide. From December 2019 to April 2020. This is a time for writing of this review. The number of affected individuals is more than millions victims. For this short review aimed to gather information in the form of the answering important question in the context of the saliva in relation to COVID-19, which is caused by the SARS-CoV-2 as an emergent infection which with limited information about. So let us start and try to answer this question. For the COVID-19, generally speaking, this COVID or this emergent infection make large and strong disruption in the community. So for the COVID-19 or the 2019 COVID-2 or SARS-CoV-2, this is the structure of this virus from the outside. This is structure from the outside and the structure from the inside. So the important structure for this virus is the spike protein, through which this protein can invade the tissue and go through the cells. Other things is the lipid membrane. There is a lipid membrane for this virus. Other things, there is the nucleic acid or the genetic material through which this virus replicate and uh, grows. So so for saliva, let us speak briefly about saliva. The saliva, water constitutes 99% of saliva, while the other constitute 1%. Other things or other fact about the saliva is the complex isotonic substance gain its hypotonicity as it travels through the ductal system. Other fact about saliva, it has only 1/7 of tonicity of normal interstitial fluid. In the healthy individual, average salivary flow per day is range between 1 to 1.5 liters. So our talk of today is to make relation or what is the relation or what is the point sharing between the coronavirus and the saliva. What is the relation? What is the relation between the coronavirus and the saliva? So we attempt or we try to find also we find the answer of the certain question related to this relation. So and actually this is the aiming or the aim of this The aim of this review is to gather information about the relation of saliva and the COVID-19, number one, and number two, answering the certain important question about this relation. So let us know what is the question. What is the question? It starts with a question. Question number one is the how does saliva get infected with the coronavirus? Question number two, what is the role of the angiotensin converting enzyme receptors expressed in the oral cavity in the context of the pathogenesis of the COVID-19 disease? The third question, what is the lifespan? Third question, what is the lifespan of the virus in the saliva? And the fourth question, what is the role of the saliva in diagnosis of the virus? The fifth question, what is the role of the antiviral component of the saliva in combating of the coronavirus? These fifth questions through which or we need to or attempt to or try to find an answer and go and went through literature and dig it deep to find the answer. So let us all together know this is the answer or suggested answer. Okay. From the beginning, we want to know how the virus get an access to the saliva. What is the access? What is the access through which the virus can go to or reach saliva? Okay, let us find an answer. What is an answer? So the answer is suggested. When we went through the literature, there is a suggested source of the saliva of the virus actually in the saliva. First thing is salivary gland. Salivary gland. So whenever there is infection, if there is infection, or if salivary gland is infected, so can release its particle through the saliva. Other things, crevicular fluid, through crevicular fluid, when there is an infection or through the blood transmission, the blood, if the transmission of the virus from the blood when the patient is infected with the coronavirus. So blood transmission or the virus can reach the crevicular fluid through the blood, as the crevicular fluid is the oral or specific oral exudate. So from the crevicular fluid, so this virus can reach also the saliva. Other things from the respiratory secretion from the infected person, there from the respiratory secretion go up to the oral cavity and the saliva get infected. Okay. So what other question? The other question, what is the lifespan of saliva in the virus? So let us know the answer. So the answer for this question of the most coronavirus are stable at the slightly acidic pH 6 to 6.5 than an alkaline pH which matching or near the normal pH of the saliva. So the saliva is a good environment for the coronavirus to live and survive. The other fact that the SARS-CoV-2 RNA could be detected in the saliva for up to 20 days. So that means this virus can survive or live in the saliva for up to 20 days. So what other questions? Is the saliva can be used for the diagnosis of the COVID-19? What is the answer? Let us see the answer for the diagnosis of this infection. So for the diagnosis, there is a couple of tests that we can or they can be used for detecting of the virus. The first one is the viral DNA, nucleic acid extraction, and real-time reverse transcription quantitative polymerase chain reaction for 2019 nCoV by detecting of genetic material of the virus. This is the first test. This is the first test. The other test is a saliva culture. By culturing saliva, you can demonstrate the leaf virus, the presence of virus. The virus will present at this culture, and other things. The virus induced cytopathic effect, which can be examined daily up to 7 days. What other questions? What are the advantage of saliva in the diagnosis, and in other way, what is the saliva advantages in detecting or in diagnosing this emergent virus? So what is an answer? Please let us know what is the answer. The answer, what is the factor that led the saliva is advantageous in diagnosis of the COVID-19? The saliva is non-invasive. The procedure of taking saliva as a specimen is a non-invasive procedure, so it is convenient. Okay, other things, taking in an outpatient clinic, so that can make by self-collecting. The patient, him or herself, can collect the specimen by him or herself. So other things, there is no need for the trained staff to take this specimen. So this also can reduce the nosocomial and transmission of the disease or spreading of the disease. Other things is no waiting time, as no need for the training staff. There is no waiting time, so we can expect the fastest result from the saliva as a specimen in the COVID-19 diagnosis. So other things, or moreover, the saliva is as a tool for diagnosis, is not just for the diagnosis, but moreover for the follow-up. And as we know, for the follow-up of the disease, we need more than one specimen collecting from the patient to follow up the disease. So by detecting the viral load, so we want to detect the viral load to follow up the disease. So this is a regular manner. So for the saliva as a convenient specimen, as it's non-invasive specimen, this is can be smooth for the patient, and this is called the serial salivary specimen. So other questions, actually, how saliva does fight COVID-19. So before time, we want to make a relation between saliva here. The main issue is the saliva. The main issue is the COVID coronavirus, and the second is the saliva. But by now, we want to know what is the role of saliva in combating the coronavirus. How does the saliva be strong enough to combat this virus by itself? So let us know what is the fact behind. So for the saliva itself, there is the proteins has got antiviral activity. There is antiviral activity in the saliva. So this antiviral activity in two things. There is immunologic proteins like salivary agglutinin, secretory IgA, secretory leukocyte protease inhibitors. There is another non-immunological proteins. Okay, this is like lactoferrin, lysozyme, mucins, and peroxidase. So there is more than one element in saliva helping saliva to make antiviral activity. So the question will come, why the saliva couldn't or cannot combat this virus? So the answer, why, or the question, why doesn't saliva combat this virus? So let us see the answer. For the answer, for the antiviral itself or antiviral the saliva have relatively limited antiviral potency and little bit of restricted mode of action. Um, this is fact. So this is let the antiviral activity of the saliva is limited. So what other things? The concentration of the antiviral salivary protein differ from person to person, and this can explain one person can be infected and the other not, or can combat or defend the disease more than the others. Okay. uh, what other things, or what other question, or what other relation that we want to know or answer? This is answering this is that virus and angiotensin converting um, enzyme 2 receptors in the oral cavity. So for the angiotensin converting enzyme 2 receptors, it is by comparison this virus with the other virus of Middle East virus, coronavirus syndrome. Those literature, when digging in literature, we found that there is a similarity between the disease 2 virus, and according this similarity, they suggest or propose that the same entrance of the previous virus can be in this virus, and for the previous virus also the entrance of for the virus is through the angiotensin converting enzyme 2 receptors. So as we know also, the angiotensin converting enzyme 2 receptors is found in the many organs like a heart, a kidney, lungs, and through which the virus can go through the cells and manifest itself inside those tissues. So what about the oral cavity? Is there is angiotensin converting enzyme 2 receptors in the oral cavity? So the answer is yes. Or the recent results showed that the angiotensin converting enzyme 2 could express in the oral cavity and was highly enriched in the epithelial cells. So accordingly, so this and furtherly among different oral tissue, the expression of these receptors or these cells in the tongue, in the buccal mucosa, and in the gingiva. So, what is the significance of this finding? This finding indicates that the oral mucosa may be potentially high risk route of the 2019 nCoV infection. So, for this finding, or from this finding, we can guess or we can predict that there is oral manifestation of the COVID-19 virus. So what about the oral manifestation of the COVID-19 virus? So there is many reports. There is a many report show that there are oral signs associated with COVID-19 infection, but still a lot of researches predicted to confirm the presence of the more symptoms and signs related to the oral cavity. So, at the conclusion of our talk, more than one point are discussed, or we try to discuss or make relation between the saliva and the COVID-19. In this review for saliva in relation to COVID-19 virus, although not all the answer for the question are totally conclusive, but just we aim to reflect the light or shed the light on these points for the saliva as promising tool in both diagnostic and follow-up for the COVID-19 virus as a convenient and practical tool. So we would like to invite even many researchers, or even many researchers already on their way to make a lot of researches, and these researches would be anticipated for putting clear answers for the mentioned questions. So my contact at the end, my contact, this is my email, Dr. Manal Eltahir at Qassim University .org, and this is my contact in the Twitter, this contact in the Facebook, and this is my channel in the YouTube. Welcome you all in contact, and for further inquiry, for further question about this topic, And I want to say to you all thank you, and at the end, nothing is important than take precautions. Thank you, all of you, for listening, and keep attention for my topic of today. Thank you, and مع السلامة.